Y bueno, ya que entramos en materia de la clínica de la raza, sí, la clínica de la
Ujú.
raza. Entonces, ¿cómo fue que se reunieron cómo es el papel de usted con el señor, no sé si Castro estuvo de comienzo, pero él estará en el libro también.
Sí.
Y Hayes Bautista,
Bueno,
cómo se conocieron? ¿Cómo se
Luis
reunieron?
Batista era el primer
Ajá,
director.
ajá,
Él se fue a UCSF, a la escuela de medicina, y mucha gente, mucha gente que como la escuela de ley tenía un grupo, también la escuela de medicina tenía un grupo. Se llamaban CHE,
ajá,
ah, Chicanos in Health Education. Pero en otros lugares, y no nomás en San Francisco, estaba pasando lo mismo.
sí.
El movimiento pues, era por todo el estado. Y empezaron they started knocking on the door. Knock the door down. We want in. And why aren't we getting in? So there were little changes, but there were changes. And those people that went in would come to the community also with the same idea, do service in the community. And they did. And so, for example, the School of Optometry, we had two optometrists come out to the community on a regular basis. And I started a optometry clinic. So we built a building for optometry. And then dental. There were some dentists that wanted to help out in the community, and they came. There's a place that they could find that they felt comfortable and the community felt comfortable going to. And this was happening in the Fruitville, but it was happening in a lot of other places, including throughout Alameda County, but throughout the state. And so the community health center movement began to come up and assert its power, assert its that it lives, it exists, and it can do something, and it showed it can do, and in a number of areas.
¿Tiene alguna anécdota de cuando se fundó la clínica? ¿Alguna anécdota que todavía recuerda?
Es como de
¿Anécdota, alguna ocasión donde hubo algo que fuera muy doloroso, que fuera muy chistoso o que les hiciera repensar?
bueno, mm, de repensar nunca.
Ajá.
Nadie que se estaba reuniendo a pesar de que no tenía un sueldo de que era adecuado.
Mm.
We were not we didn't have money. We didn't have that much money, but whatever money we had, we divided it as equally as possible. So people had something to work with, and that was enough to live on at that time. Okay. Um, we had one situation with the dental where a person in the community did dental, dental supply person, and he found a dental office that was closing, and they were willing to donate all their dental equipment to us. Okay. Well, before that happened, the, the wrecking ball came. They came and they destroyed the building with everything, all the dental equipment in it. Okay. It was gone. Okay. Well, we thought, well, that's it for now. Well, out of nowhere, then we started getting offers for all new equipment. And we just had to have a place to put. So we then got space for, like I said, dental optometry.
Mhm.
We got a building. There was a pastor who uh, retired. I think the church was going to go away. It was scraped. There wasn't church there, but the property was available. He said, "I'll give you the property if you can build something on it." So starting out as a law student, then along with others, but especially I had to learn all kinds of other things. I like property law, for example. I didn't have a problem with that, but I'd never done uh, development of a building. I've never had to supervise that alone. So I learned. I had to learn, and that's the way it's been. It was with everybody, and we had Jane, for example. There's
Mhm.
all kinds of things that we had to learn about that we didn't think we'd ever have to learn about, and still be activists. We still didn't. We were still doing it for the purpose of changing the reality that was not. At least it was not hospital-run, but more than that, it wasn't. Wasn't humanitarian. What we were in facing the lack of service. We had a lot of women that we had a program called the WIC program, Women, Infant, and Children program. So they would come to us to get the written vouchers, so they would take the vouchers. But that wasn't enough. You have to have really have to have a perinatal program. Have a program that will take care of them while they're pregnant, and that will take care of the child when the child is born.
Mhm.
So we had to create one. We created them, and we not only created one, but I guess I'll go for uh, the program we created. Uh, we wound up combining uh, a fund that had never been used worked together with Medi-Cal. So we combined Medi-Cal and that fund to be able to see women, and these were mostly undocumented women. Uh,
Mhm.
and we found one hospital at that time on Pill Hill. Now there used to be three hospitals on Pill Hill, right over by Kaiser. There used to be three. Providence was the Catholic hospital, so they would allow us to have delivery privileges. We found one doctor that would deliver. That's all we needed.
Mhm.
No, that's how it happened. And right now, I think it's Sutter. It used to be three. It was the Providence, Sutter, and Merritt. Yeah, there were three hospitals.
Oh.
Mm. So in every case, what it takes is you have to talk to a lot of people. We didn't have you know the phones, and we didn't have as much of. It was you had to talk face to face constantly. And my nickname at home used to be Junta Joel. Where's Junta? What's going? Stand on a Junta. um, that's the way it is now. You can talk to people and you relate in a different way. And without going into a lot, that raises some concerns for me right now, because a lot is going into AI and doing mental health service on the phone and on the screen and like that, and the human element
Yeah.
was hurting. So the human element was very important for us in terms of that you had to meet with people in person, face to face.